And welcome Debi Lynes with Mind Your Health. You are a psychologist,
yes,
and you are a therapist, and
all kinds of fun stuff.
All kinds of things. I appreciate you being with us, Debi. Good to see you.
It is wonderful to visit with you. I look forward every month to kind of sharing things.
So the Mind Your Health segment is always on the first Tuesday of the month.
Correct.
All right, so I love that. And today we're talking about therapies, the different types of therapies.
Yes.
And I didn't even know that there were multiple types.
Well, I think people talk all the time about what does therapy look like? Is it psychodynamic? What about your mother's brother, sister? Is it cognitive? Is it about how you think? Is it cognitive behavioral? How I think and how I act? Is it somatic? Is therapy about interoception and being inside my body and really recognizing the feelings that are going on in my body? Is it solution focused? Am I trying to find an answer to a problem?
Right.
What really is it? And the answer is all of the above. And I thought it might be fun, to talk a little bit about specifically maybe one today.
Okay, so which specifics do you want to talk about, Debi?
Let's talk about cognitive therapy and somatic therapy.
What is, when you say somatic, how do you spell that?
Within your body.
Within your body.
Yes, it's within your body. What are you feeling?
All right, okay.
So remember that somatic therapy, let's say you have chronic pain. Mm-hmm. Okay, because that's something you're feeling within your body. And the question becomes, is that pain because I have a bad knee?
Right.
Or is that pain because my body has been habituated to feel the pain in my knee, even though I had a knee replacement? Because remember, body and brain are connected. You cannot separate the two. And so that's kind of what somatic is. It's feeling into your body. What are you experiencing? Okay. And then the cognitive piece of therapy is thinking. Can I change my thoughts? Yes. Can I reframe them? Yes. Can I challenge my thoughts? Can I challenge my thinking in order to feel better? Sure you can.
But you say sure you can, but that's very difficult. And you need someone like you to help guide us through that process so that we can kind of have a different self-talk, a more positive self-talk.
What's interesting, yes, but what's interesting, Robyn, is the goal of a good counselor, therapist, or psychologist is for you not to come.
That's the goal.
That's the goal. The goal is for you not to come to me.
No, but you want us to keep coming back, don't you?
Well, no, I want you to build a repertoire, or I want you to put skills and strategies in your toolbox so that you can self-regulate, manage your emotions, tolerate distress without having to go to someone else. And I think that is the goal of health and wellness, really.
Right. Well, and when we come to someone like you, you give us those tools, the coping mechanisms, the how you can change your thought process or whatever. So that's important because we just can't figure that out ourselves because that's not our expertise.
And we're not objective with ourselves.
That's true.
Don't tell me not to feel pain when every time I get up my knee hurts, right?
Right, that's a good point.
If I could, I would.
Yeah, good point.
But I think what it requires is that we do hard work. In other words, therapy and counseling is a two-way street. We're basically equals in this. We both learn from each other. There's not one size that fits all. So again, therapeutically, finding the type of therapy that matches the way that you think or learn or are motivated is going to be really important.
Does most of the therapy that you conduct, is it face-to-face or have you ever done like Zoom via?
Both.
You do both?
Well, with COVID, I think all of us had to adapt to a new way of doing therapy, which was Zoom. And I think there are many advantages to that. I think it's a great way to do it. Personally, I prefer face-to-face because there's a lot of body language. And I think we're disconnected. Can it work via Zoom? Absolutely.
And if someone's in crisis or whatever and they need to immediately call you via Zoom or via phone, you're there.
Absolutely. So I think a lot of it's accessibility. But whenever I talk with you, I feel as though the time goes so fast because it's really practical information. There's nothing woo-woo or magic about this. Everything we talk about is pretty evidence-based.
Very good. Dr. Debi Lynes, always good to have you with us on the Daily News and with the Mind Your Health segment.
Thank you, ma'am.
Again, first Tuesday of every month, and we'll be right back.